Welcome to the Movement Tools 2022, a training series from the Progressive Caucus Action Fund. And we're so delighted to have this series co-hosted by Six Action. We are doing these every 3 weeks on Thursday for the next few months, so now through July. The idea behind 3 weeks is we don't want to clog your calendar too much, but we also really want to make sure we have time to be spacious and dig into these important topics. My name is Jessica Juarez-Scruggs. I'm the Training and Capacity Building Director here at the Progressive Caucus Action Fund. I use she, her pronouns, and I'm joining you today from the unceded lands of the Duwamish people in Seattle, Washington. Encourage everybody to jump into the chat and introduce yourselves. It's lovely to see where everyone is coming from and who all is with us today. I want to start off with two quick reminders. Sorry, everyone, I have a little bit of a cold. One is that PCAF and Six Action are 501c4 organizations, but we know that many of you who are joining us today are 501c3 organizations and you're here in an official capacity. So we're going to dig deep into a meaty policy discussion today. We will not be engaging in electoral or partisan conversations. So have no fear. And the second piece of housekeeping is we've enabled the automatic closed captioning. If you don't know how to get to it, go to the bottom of the screen where it says more with 3 dots, click on it, and then you can click on live transcription and request that. If you have any trouble, let us know in the chat and we're happy to help. It is obviously an IA transcription, so it is not entirely accurate or ideal, so we will be fixing that up a little bit and when we send out the video after this event. So the goal of this training series is to dive into the policies and systems that shape our communities, identifying the opportunities and the organizing strategies our movement can use to bring the fight forward so that all of our families can thrive. The first 3 sessions, this is number 2, focus on implementing laws, especially these big pots of money that are out there right now, like the American Rescue Plan, the Infrastructure Investment and Jobs Act, or the Bipartisan Infrastructure Law. And each of these trainings includes discussions with movement leaders about this particular policy tool, but also a great little backpack of resources in the form of a Google folder that we will send out afterwards. So like I said before, if you signed up as a participant and you didn't have your email, you just click that link, that live link in the email, and you don't have your name coming in already because you registered, please make sure you register so we have your email address and we can send that out after the fact. And Heejin is going to drop the link in the chat for you all. So if you just don't see your email registered, please do sign up. Today we're thinking about policy design. How do we build equity and justice into the fabric of our public policy? What do we need to think about and plan for? How do we wrestle with justice in public policy when this collective project that we call government has been a space of trauma for so many of our communities? We know that when we think about policy as neutral, or we fail to think about this, policy reverts to the status quo of power. So if we aren't actively centering justice and equality and equity, we will be reinforcing the systems of white supremacy, patriarchy, ableism, exploitation that we all grapple with every day. So I'm so delighted we have an incredible panel today. So I'm really happy to hand the mic over to Callie Grant, who is the Associate Director and a founding member of the Georgetown Center on Poverty and Inequalities, Economic Security and Opportunity Initiative. Callie leads cross-cutting policy development, research, and analysis projects on a range of issues advancing economic, racial, and gender equity. Sorry, everybody. She has written extensively about public benefits, tax credits, COVID-19 response, job creation programs, and work supports and labor standards, and proudly roots her work in her own lived experience with economic insecurity and disability. Callie is also an AmeriCorps Vista alumna who focused on economic justice and asset building policy design and implementation at the Shriver Center in Chicago, Illinois. So welcome, Callie. I'm so excited to turn the mic over.
Thanks so much, Jessica, for your kind introduction, and to the Progressive Caucus Action Fund and Six Action for hosting this important discussion today. And thank you to everyone joining us for investing your time with us on this rainy, at least in DC, Thursday afternoon. I'm so delighted to be here with everyone. It's just a fantastic group of folks that we have to dig into this topic of equity and justice in policy design. And before we dive in, I just want to briefly ground us in this moment and and the importance of this topic here today. As Jessica said, we have billions and billions of dollars flowing into states and communities right now. And what happens with those funds will transform the landscape of our communities. This is a big opportunity to apply lessons learned, including from the pandemic response, and to seize the moment and prioritize inclusivity, equity, and justice. So, no pressure. Luckily for us, we have our panel here of dynamic leaders in their respective spaces who bring their invaluable perspectives, skills, passions, and experiences to help us grapple with all the layers and complexities of this topic. I also want to acknowledge the collective wisdom in this virtual room that we're sharing together and beyond as we dive in. If folks haven't already, or actually I'm not sure if folks can see each other, but either way, please, let's just take a few moments to bring to mind a few faces and names of people that you engage daily or regularly on in this work together. And let's also connect to this space we're sharing here together now, and to this deeply important work that we're doing in community together. I'll pause a few seconds just so everyone can kind of take a moment to think about that. Okay, great. Thanks everyone for getting present with me. So our first goal here today is that whatever your role in this movement, you come away with something, either a fresh idea, a new perspective, a new strategy, maybe just a renewal on energy, frankly, and that you can apply in your own efforts as we individually and collectively work towards centering equity and justice in policy design. So the format, to give folks an idea of what to expect in the time that we're about to spend together. In a few moments, I'll introduce our fantastic panelists. Then I'll kick off the conversation asking some questions that draw out some of the high-level themes and ideas we should be thinking about. And then for the remaining portion of our time, we'll open things up to give folks an opportunity to ask questions that you've been thinking about in your own efforts, navigating how to actually build equity and justice into policy design. So, sound good? Great. All right. So let's get started with panel introductions. So first, it's my pleasure to introduce Nzinga Hooker, the Policy Director at the National Black Worker Center. Nzinga is committed to supporting power building and leadership development in Black communities, and to use her legal experiences and skills in service of that work. Thus, all her work is grounded in a racial equity analysis and aimed at actively contributing to the dismantling of structural racism, also building worker power and addressing income inequality. Prior to joining NBWC, she worked as a staff attorney with the National Employment Law Project, where she worked on unemployment insurance policy, helped integrate NELP's social insurance work and work equity portfolios, and deepen NELP's racial equity work. Most of her work as an attorney has been in direct services and litigation. And Nzinga holds a BS in biochemistry from Claflin University and a JD from the George Washington University Law School. Next, I'd like to introduce Mia Ives-Rubley, Director of the Disability Justice Initiative at the Center for American Progress. Prior to coming to American Progress, she advocated for disability justice and inclusion at nonprofit organizations and businesses across the US. She's worked with the Women's March, Families Belong Together, DC Action Lab, Adoptees for Justice, Fair Fight, People's Collective for Justice and Liberation, and numerous other progressive organizations. Best known for founding the Women's March Disability Caucus, Mia helped organize the original Women's March in Washington in 2017, and pushed for better access to disability accommodations at the Women's March and many other progressive events. For her work on the Women's March, Ives-Rubley was named by Glamour magazine as one of 2017's Women of the Year awards. She was also recognized by She the People as one of 20 women of color in politics to watch in 2020, and awarded the 2019 Distinguished Alumni Award from the University of North Carolina School of Social Work. Ives-Rubley holds a bachelor's degree in sociology from the University of Illinois at Urbana-Champaign, and a master's degree in social work from UNC Chapel Hill. Now it's my pleasure to introduce Jennifer Fairbanks, who's the communications director of the National Organizers Alliance. Jennifer is an enrolled member of the Red Lake Nation and a descendant of the Blackfeet Nation. She currently resides in St. Paul, Minnesota, on traditional Dakota territory. Much of Jennifer's work has focused on Native representation, storytelling, and social justice, and she is committed to elevating Native-led grassroots movements at the local, national, and local levels. I'm also delighted to introduce Diana Pliego with the National Immigration Law Center. Diana, who's based in NLIC's DC office, works on a range of issues, including protection for DACA recipients and fighting immigration enforcement. She conducts policy research, analyzes and tracks legislation, and develops materials for movement and field partners, as well as for congressional advocacy. As an immigrant with a passion for social justice, Diana designed her bachelor's degree at Columbia College in community and policy advocacy. While in undergrad, she helped found a grassroots organization called Young Immigrants in Action in South Carolina. She organized and trained young immigrants from across the state to advocate for themselves and their communities. She has since worked on federal policy for a faith-based social justice lobby and as a campaign field organizer before continuing her work on immigrants' rights at NLIC. And last but very not least, I'm delighted to introduce Nahal Zamani, one of our co-hosts for today and the Vice President of State Strategy and Services at Six and Six Action. Before joining Six Action, Nahal was the Director of Movement Building at Demos, a progressive think tank that powers the movement for a justice, inclusive, and multiracial democracy. Nahal previously served with the Center for Constitutional Rights for over a decade and led human rights advocacy and campaigns at the national headquarters of the ACLU. So again, welcome everyone in the audience, and welcome again to our fantastic panel. It's just so exciting to be here with you all. So let's dive right in. I want to begin with a question for each of our panelists. So we know that many policies that on the surface seem neutral instead reinforce systemic oppression and put up barriers that harm our communities. I'd love to hear from each of you about the types of barriers within policy design that you see harming our communities, and some of the ways that we can proactively design policy to counteract them. So how is policy design falling down on the job, and what can we do about it? And maybe we can start with Nzinga.
Sure, can everyone hear me? Awesome. Yeah, thank you for that question. I can kick us off. Before I get into my response, I did want to provide a little bit more context about my role at NBWC. So I hope I'm saying your name correct. I missed the introduction, but Kylie, as Kylie said, I am the policy director at the National Black Worker Center, and our mission is to organize Black workers to build power needed to achieve liberation by dismantling systemic racism and economic exploitation. So in my role as policy director, I have a focus on Black workers, especially working class Black people who live in the South. So it is to develop policy and advocacy resources and tools that support that organizing and power building work. So when I think about the barriers within policy design in that context, there are many. So we're not gonna get into all of them today, but there are many. Oftentimes policy design moves too fast, right? And that is harmful to many communities that we work with because it doesn't provide sufficient time for community members to be involved who are working long hours, multiple jobs, may have caregiving responsibilities and can't respond as quickly or engage as quickly as many people who have that flexibility and time. Another barrier that we have seen in policy design is that the direct experiences of Black workers are rarely centered in policies that address a lot of the issues that we work on, which is job quality. So there's often this hierarchy at play where the solutions of technical experts who go to school to get their experience and their learning are placed over lived experts who know the actual things that are happening and experience the impact of policy. So that's a big barrier that many people are starting to address and figure out ways in which to counteract that. I'll also say for Black workers in particular, policies that address whether it's job quality, whether it's health and safety, living wages, organizing, legal rights and protection, whatever it may be, is particularly layered because our success in the labor market depends not only on labor laws that center us, but also anti-racist policies that redress, years of labor exploitation and discrimination. So when policy designs do not include both pieces, there are barriers and it's not sufficient. So I won't go into much more details. I know there are a few other people who have to respond, but I'll say oftentimes what I've seen as barriers was when you don't incorporate organizing and enforcement into the policy design. So it's either, I've seen it play out where organizing isn't a part of the work in the forefront, so the legislation doesn't pass because that pressure and strategy isn't there, or if the legislation does pass and organizing isn't involved or enforcement isn't a major piece, then the impact is lessened. And we don't have that clear implementation process. So I think those are some of the barriers that are in place, and some of the things that we're working to do is to incorporate a participatory design process that is a little slower pace and involves people and organizations that aren't often in those policy conversations. So I'll pause there for others to talk.
Yeah, thanks so much. Mia, do you want to jump in here?
Yes. My name is Mia Ives Rubley. Again, I work for the Center for American Progress. I work under the Disability Justice Initiative. So I focus on disability and all of its impacts, which crosses over into, race, gender, LGBTQ issues, etc. And I also want to state that I was an individual who was on SSI for a long time, SSI and Medicaid, and also worked as a vocational rehabilitation counselor. So I have worked in, or have had perspectives in pretty much all three layers of sort of the policy decision making. And what I will say flat out is that there's absolutely no policy that is neutral. So every policy will either be looking to create a flatter sort of structure, or it will be creating barriers and sort of a pyramid of accessibility and access points. So that's one of the things I really want to focus on, is that particularly when we're talking about policies, we particularly want to look at administrative barriers or administrative burdens, which disproportionately impact disabled people. And it's sort of part and parcel of the bureaucratic disentitlement strategy. So it's creating so many barriers that individuals feel so frustrated that they're not going to utilize the services that are out there for them. So we see that in a lot of our safety net programs. We see it even in our entitlement, quote unquote, entitlement programs. And so, these can include anything from proof of disability, having to go to the doctor to get that proof of disability. So having to pay that copay, having to pay that doctor's fee, proof of ID. And tons of individuals don't have an ID. And I know I've talked to so many people who are like, why wouldn't you have an ID? Don't you have to use an ID all the time? And I'm like, look, if somebody is houseless, they may not have access to their ID. Their ID may be in storage. Their ID may have been lost. It could have been lost in a fire, etc. There's many different reasons why people don't have access to an ID. Lack of accessible transportation, particularly in rural locations, lack of centralized offices, having to apply to services in multiple locations, lack of information. We know that a lot of individuals only get services because they know about the services. And so that's another barrier. And then requirements around recertification. Now we have to really sort of think about, why are people putting these burdens and these barriers in place? And part of it is because it believes that it is trying to stem abuse of a program. And it basically makes a decision on who is worthy of services and who is not. And a thing that we need to do in order to repair this is to really rethink what our safety net programs are, and think of them more as a rights-based approach rather than a deserving approach, which is what we've heard probably time and time again about the deserving poor, the quote unquote deserving poor, right? We kind of see that right now with the immigration issues where Ukrainians are seen as deserving refugees, as individuals at the border are not seen as deserving, quote unquote deserving. So we really need to rethink how we see who's deserving and see that everybody is deserving. I think another thing is centralization of services. So many times individuals have to go to 7 different offices, and that takes hours out of their day to be able to get things like SNAP, TANF, things like vocational rehabilitation, etc. These require you to go to multiple different offices and apply to multiple different things and show all of this ID and financial information, etc. And trying to centralize that and actually create just one application process to gain all of these services, because we know that if you are eligible for X service, you're likely eligible for Y service. So why don't we just centralize that? And I'm really appreciative of sort of the thought process of the current administration and trying to push that of the no wrong door policy. So that's one of the things that we are also thinking about. I think last, as Nzinga said, that the people closest to the pain, as Presley says, the people closest to the pain should be closest to the power, driving in informing policy making, right? So too often we aren't paying attention to the people who are experiencing the issues, who can actually provide real world knowledge about how policies are enacted on the ground, because there's so much difference between what happens in bureaucracy and sort of in case studies versus what actually happens in everyday life, and we really need to take that into account.
Yeah, that's so important. Thank you. Jennifer, you want to weigh in here?
Yeah, absolutely. So thank you for having me. Again, my name is Jennifer Fairbanks. I am the Communications Director for Native Organizers Alliance, or NOA. We are a traditionally organized circle of tribal and Native communities and groups supporting grassroots leadership development and organizing capacity. So we're an organizing and training network dedicated to supporting tribal and Native community leadership to achieve structural reforms that lead to achieving our sovereignty. So for tribal communities, a major barrier is the lack of consultation from the federal government. Consultation right now is just an idea or a line item to be checked off, or it's a recommended practice. What we need to see is Native people being part of that decision-making process. We know what's best for our land, and our people, so consultation should be the first step. The ultimate goal, however, is consent. At NOA, we talk a lot about free, prior, and informed consent, or FPIC. The United Nations Declaration on the Rights of Indigenous Peoples set the standard for FPIC as a basic human right. So it's a basic human right not only to be consulted on decisions that will directly impact them, but to also say yes or no. It outlines the protocols that provides Indigenous peoples the opportunity to have decision-making authority and participation. With free, prior, and informed consent, tribes can freely exercise the right to self-determination, economic development, protection of sacred places, and provide safety to our communities. But consultation is definitely a good starting point. For our urban Native communities, they too are affected by the lack of consultation. We have specific needs in health and housing that relates to our treaty rights that were guaranteed by the government. Those treaty rights need to be met no matter where we live. So we need consultation before decisions are made. And instead of it being a line item, it should be meaningful engagement with Native communities. It should be part of the planning and policy development from the beginning. Taking that step would mean ending the waste of resources on lawsuits by tribes. It would also mean policies and plans that are better suited to the needs of both Native and non-Native communities. So one example of this is the Dakota Access Pipeline, right? That was a struggle by Native people to protect the Missouri River for the 17 million people who live, drink, and fish downstream from the Standing Rock Reservation. Another barrier is representation. Native peoples are not considered a standard operant procedure of the functioning of state or federal governments. For example, last month, the federal government announced that it'll start collecting unemployment and jobs data on Native Americans for the first time ever. So let that sink in. Unemployment rates for Native Americans have never been broken out by the federal government before. This is majorly important for us and for policymakers because we need to know what the realities of Indian country look like. So if policies around jobs, economic development, and unemployment are being made with Native Americans as a blind spot, then we're being left off the table completely. Policies need to meet the needs of all people, including Native people. Tribal nations must have an equal footing status when it comes to responding to the climate crisis or new highway systems or other development projects. For every piece of legislation, we need to be asking, what is the approach to tribal nations? Of course, funding is also a major barrier. Our services are extremely underfunded. We are the only people in this country who have to compete against animals for our funding. So our Department of Indian Affairs and the Bureau of Indian Education are in the same department as endangered animals. So we're competing with wolves and condors for funding. I also want to make a note that when we're talking about Native communities, there is a tendency to homogenize all Native peoples. So I just want to add that the needs of tribal communities can vary from one another and also differ from urban Native communities and how they're impacted by policies. But there definitely needs to be conversations with tribal leaders to ensure that there's adequate funding and attention given to Indian country. It's important that we're not only engaging Native communities by working with them directly, but also bringing forward those community voices. And I will pass it along to somebody else.
Yeah, thank you so much, Diana.
Yes, I was nodding along to everything Jennifer was saying because it's a lot of, I think, what I was planning to say. I think when thinking about answering the question of how do we make sure that policies are inclusive of people and not overlooking, the barriers that might have people on the margins, right? The key component is relationship with those communities, right? It's that consultation process, but even further, it's having an established relationship, whether it be with the state and local organizations that represent those communities. For example, from the immigrant perspective, there are probably many already existing immigrant-led organizations or state local advocacy organizations who, if you have a good relationship with them and you're in an official capacity, you can consult with them, and they would be more than happy to work with you and meet with you when designing policy to make sure that the barriers that they're aware of are handed over to you all. And I think also getting creative and being willing to invest in that relationship, right? We can't expect that that information is just going to come to you, or that even those organizations are going to know the community necessarily as well as the community itself. I know some of the things that we as advocates have done at NILC and are currently doing is, for example, making sure that we put together, for example, community forums to inform our policy agenda. And so we partner with state, local organizations who have those relationships. We make sure that we compensate folks who are coming into these forums, right, for their time, providing childcare, providing language access, providing transportation, making sure that it's accessible for them to come and provide that feedback. And, all of this obviously requires resources, right? And so it requires a lot of intentionality from the beginning and a commitment to saying if we want to make sure that we are inclusive, they cannot just be a little checkbox that we say, oh, right, are we including them? We have to truly go out into the communities and make sure that they feel genuinely heard, and then taking that feedback and not just putting it aside, right? But truly taking that into the policy and being open to feedback, even once the policy is out there. And let's say the organizations or the community saying this is still not working, being willing to amend that. And I think sometimes that is overlooked. And you said, well, we tried, but that's often just not enough, right? We have to be willing to accept that maybe we messed up and we fumbled the ball in designing a policy, or maybe the community needs are changing and we need to be able to listen to that. I can think of as just, a quick example, given the recent events of COVID, for example, it's a really great example of, obviously, first at the federal level, undocumented immigrants were completely left out of stimulus and funding, right? But we, for example, tried to include them in vaccine access, right? So we made vaccines accessible for everyone. While we were working on getting them the stimulus funding, we figured people have access to vaccines. But unfortunately, a prime example is even me, my family. I'm a DACA recipient. I have a mixed status family. And one thing that is incredibly important is the access that people have. I was sitting here from DC telling my parents, I can sign you up for a vaccine right now. It's online on CVS. Like, I can go in and set this up. And they were like, they decided to wait much longer than I would have preferred, until they could go an hour away to the free community clinic that they go to, where they know that they would be welcomed, that there wouldn't be staff that doesn't understand their status, that there wouldn't be staff who would maybe have a bias against non-English speakers, against immigrants, where they felt safe. And that is where they chose to get their vaccine, right? So those are the kinds of things that you may not think about if you think, oh, we're making it accessible. It's a quick, easy thing to sign up online. But let's face it, not all immigrant communities, especially folks from like my parents' generation, are not tech savvy, and we have to be able to and willing to do the outreach. There's something called promotoras, which are essentially people who go into the community and do education in the language, people who understand the cultural dynamics of the communities, who can go in and educate people about services available. And they have been proven to work over and over again, because that trust needs to be there. And so that's why I think it's so important that if we want to have that consultation, that it really is something intentional and it is continuous. It is not just at the very end when you're getting ready to publish a bill and put the text out, hey, does this sound right? But no, we have to, from the beginning, be in that conversation. And so I think that's the best way to make sure that people aren't overlooked, that communities are truly included and that their barriers are known, is to really start from the beginning and being willing to invest in those relationships and bringing the community into the process, into the fold from the very beginning. So I will leave it there and pass it on to the next speaker.
Yeah, thanks so much. I believe that's Nahal.
Thank you. And thank you for all my co-panelists for gathering today. My name is Nahal Zmani. I'm a senior vice president at 6 Action, which is a nonpartisan C4, a strategy and advocacy organization dedicated to advancing and achieving progressive change at the state level. When I think about why policy design can inherently continue structural barriers, I think of several fundamental reasons at play. The first is that participation and assessment need to be the goal, right? And there are structural barriers that preclude this, and they're either explicit or implicit. And I think more largely, we've often in our policy design work, we fail to ensure meaningful community participation and access because we see it as intrinsic to achieving and creating meaningful shifts in power. So when I think about laws that I've been a part of and advocating for, passing, and then seeing them come to light, I think one of the most significant reasons that my co-panelists have underlined is both how we anticipate and then actually create opportunities for meaningful participation by impacted communities and their legitimate representatives, right? And we could probably problematize legitimate representation in a different discussion here. The second issue I want to echo from our co-panelists is something even to push about, we really need to be able to see and assess how policies are leading to tangible impacts on people's lives. And we need to be able to ensure that shifts are taken when policies fall short or when they fail. And we don't always think about assessment as one of the most crucial cruxes of policy design. What's more, I've seen that when we fail to resource, as one of my co-panelists shared, community participation, when both designing these policy solutions, but also overseeing their implementation, that is a huge barrier that actually leads to policies failing. In fact, I believe that both implementation and monitoring, those are some of the most important aspects of any policy change that we want to see, but actually one of the moments that we least invest in, both as a movement, both as lawmakers and people that serve in varying entities in the government side, but also as funders, right? So all of us are kind of failing to lead and build and invest in this crucial moment when a law is passed or policy is modified to be less harmful, to ensure that the people that monitor it are actually from the communities that it's designed to improve the conditions of their lives. And so when I come around, when I wrestle all this, is this fundamental belief in co-governance, right? That communities and governments should co-design and collaborate and share in decision-making, that we challenge this idea that people in government alone make decisions that impact our lives. And we believe that shared decision-making power and centering impacted people is key. And then to attend to that, we create these explicit structures, these structures that do allow for collaborative decision-making. They don't create one opportunity for one occasion or consultation, but they're actually entirely designed around this premise. And we do it because we think that our larger vision of justice means that we actually have to build power together. So when I think of this in the initial question, it's not that we should be satisfied with policy mitigating harm. We should be instead insisting that policy is about building our collective power. Thank you.
Yeah, thanks so much. And just to echo some of the through lines that really were coming through for me listening, it just really just the importance of slowing down and building in space and time for that truly meaningful engagement and access that does involve consent making and co-creating there, and as well just making sure that that's really coming through at every level in every way in meaningful ways, and also thinking about what resources are being allocated. You know, back to Mia's point, even around it takes resources for bureaucratic disentitlement to be a thing and to happen. That's putting incredibly huge burdens on folks who are trying to access things that supports and services and things, and that those kinds of resources need to be invested in communities, like Diana was lifting up with the promotores and other ways to invest in community resources, so that at every stage it is that co-governance and investment and engagement together. So thanks everyone for sharing that. We're gonna switch now into some other questions for individual panelists, but if anyone wants to chime in on any of the questions, please do just let me know, and we can make it a little bit more conversational if anyone wants to. So, and Zinga, I have a first question for you. So the National Black Worker Center and many of your partners are working on a Black Workers Bill of Rights. Can you tell us some more about that project and what's needed for Black workers' rights to be truly recognized, protected, and enforced?
Sure. So last year around October, about 20 plus Black-led and centered worker-focused organizations came together and formed the Black Worker Policy Coalition that we're continuing to grow. And because this session is more about building equity and justice and policy design, I'll share a little bit about how that coalition formed. We went through a really intentional process of building out the coalition, where members who were invited to participate shared their organization's values, their vision, their mission, and all the members sought alignment around that, because we knew that it was important for this particular initiative that we're leading, that there be less tension and compromise around that work that we would take on. So building this coalition in a way where organizations that are not often brought into the national policymaking space were included, that we were taking time to build this community and trust in that space. So that could involve, at every coalition meeting, we do some sort of relationship building work in that space to ensure that alignment. We also had a process of ensuring our base, our members' needs and interests are acknowledged and included in the design of the Black Worker Bill of Rights, which included that we made sure we invited and have coalition members who are national organizations, who are state-based organizations, organizations in the South, organizations that work with Black LGBTQ people, Black immigrants, Black workers with disabilities, and so forth, so that all those perspectives were included in the policy design of this Bill of Rights. And when we came together as this coalition, we committed to working together to address the many issues that Black workers are facing in the job market and workplace. So we have been working together for a few months now to produce this Black-led national policy agenda that would improve job quality and advance racial and economic justice in this country for Black workers. So that is what you're referring to as the Black Worker Bill of Rights. And it's really about building a new anti-racist economy that works for everyone. And that is captured in this 10 umbrella rights that all Black workers must have, and that must be meaningfully reflected in the law and enforced. So we put a big emphasis on enforcement. So some of the rights, like the right to organize, which is a priority in the bill, is a right that we already have. What the bill does, it affirms that right, and it also calls for greater protection of that right and expansion of its coverage. Other rights include a right to equitable compensation and wages that is owed to people, that speaks to family supporting wages, issues of pay equity and transparency. And it also includes an important framing of reparations. And there are 8 other rights that I won't go through all of them, but it's pretty extensive, and we'll be launching it on May 2nd, so you'll get more details then. But to your next part of your question, which is quite a bigger one, which is what is needed for Black workers' rights to be protected. This legislation is a part of that we're pushing, but it's so much more. It's going to take coalitions working together. It's going to take partners like CPCC and folks working together on this. It's going to require boldness. Black workers are going to have to be even more bold and take even more risks than we already have, which is a big one because we've been fighting for protection of our rights and labor for a long time. It's going to take honesty and enforcement, clear, detailed, and targeted implementation, which is often missed in a lot of legislation that is passed. It's going to be taking recognition by policymakers and people who influence policy that Black workers are your constituents too, that you have a responsibility to protect Black workers or you're to be held accountable. I think real emphasis on that accountability is going to be necessary. I mean, there's so much that can be talked about here as far as what Black workers need to have their rights protected. I think in what I said earlier about in the design, which protection should be built in, is ensuring that Black workers are centered, workers of color are centered, and that the harm that is currently happening and past harm is being repaired in conjunction with new rights that are being established and new protections that are being established. Which the example that comes to my head is, when you're seeing like the legalization or in some places, the decriminalization of marijuana, and you see these new businesses that are being opened up around legal business for marijuana, and you would look at that policy and say, oh, that's so amazing. That's going to impact so many Black workers. But that language in itself isn't sufficient because what it doesn't do, it doesn't address all the harm that has been caused by arrests, by convictions. It doesn't compensate for those actions that were taken. It doesn't ensure that Black businesses, Black workers are going to be factored into the new businesses that are open, are going to be factored into the licenses that are given. So when you think about these policies that are to protect Black workers, you have to have both in play. So I'll just pause there for folks to go.
Yeah, thanks so much. That's such an important point about how any policy design efforts need to be rooted in the realities of the existing historic and structural oppression and like you said, repairing the harms and recognizing them while you are then co-creating additional new rights and new directions, right? So thanks again for sharing that. Mia, so question for you is, our government systems have a long history of, or actually before that, does anyone else want to jump in and respond to Nzinga? Alrighty, cool. So yeah, Mia, our government systems have a long history of ableism and violence towards people with disabilities, from employment discrimination to forced sterilization, that all were enacted in the name of quote unquote protection. So what are some of the ways that we can begin repairing those harms and undoing paternalistic policy systems?
Yeah, I think that there is a misunderstanding that most of the sort of laws that pertain to disabled people are for protection. I think there's quite a bit of laws that are based on eugenics, the belief that individuals with specific disabilities don't deserve to be a part of our communities and don't deserve to have equal rights as other folks in the community. So I think a lot of people think that that none of the harms that are done to the disability community are intentional. I do want to break that stereotype because there are many laws that are intentionally keeping disabled people, particularly disabled Black and Brown individuals, from being able to participate in their communities, have fulfilling lives, and build families. So I think one thing that I do want to push back on is it's that, you know, some of the bad policies are done intentionally to keep disabled people out of communities. So one of the things, you know, because I like to think about, you know, we all, you know, talk about the things that are causing the issues within our communities, but you know, what's going to actually fix the solutions. And you know, I think much like the rest of the folks on this panel, there needs to be real structural change in order to build towards a more equitable society that you know, that humanizes and values all different types of lived experiences. And so one of the things that I think a lot of people don't understand is that disabled people are whole human beings, right? So that's an important thing for folks to know, is that we're whole human beings, that we should have the same rights as anybody else. So that means that we need to move away from a society that only values people for their ability to produce, which is one of the reasons why I often push back when folks are like, let's focus solely on, you know, worker rights, is because that delegitimizes some experiences of people who can't actually work, right? So I think that's really important. Is like, yes, voter rights is extremely important, but that's not going to solve all the issues within our communities, and that we have to expand out to understand and include people who can't work in traditional type settings, including immigrants, including disabled people, including people who are incarcerated, right? So we need to think more broadly, understand that any person, no matter their background, no matter their experiences, or even their legal history, has human value, and that they should have an intrinsic base of rights within our society. So, you know, how do we do that? How do we give those people, the wide myriad of people who are often left out of our society, the rights that they deserve? One of the things that I often talk about is disentangling healthcare access from work, right? And I know that this can be sort of a fraught topic, particularly because I know unions had worked really hard to get these basic rights on health insurance. The problem is that means that people don't have choices, right? So particularly disabled people, they don't have a choice to go create their own business or to go contract out. They don't have a ability to work part-time jobs if they need that health insurance. So it's extremely important that we disentangle the healthcare system from employment. So that's one of the biggest things that I talk about. The second thing that I talk about is fully funding home and community-based services. A lot of people don't really understand what that entails. It entails a wide myriad of services. So not just home care. It actually supports individuals within their communities. So individuals who want to go shopping, individuals who want to work, it provides those services for those individuals. And so that's why it's so essential that we fully provide funding for that. It will also help get people out of incarcerated settings. So it is a racial equity issue. We need to ensure that we have home and community-based services for everybody, even folks on Indian reservations. We need them more broadly, and we need to fully support that. And then the last thing is a truly universal sort of way to pay people, right? A universal economic system that allows individuals, even if they cannot work, to be able to survive in our society. I say this because so often, as I talk about earlier today, administrative burdens. In the disability community, you have to prove that you're disabled enough to receive disability services and support, but not so disabled that you have to live in an institution. That's basically the tightrope walk that all disabled people have to do. And that's why so many individuals aren't willing to identify as disabled, because they're like, whoa, I'm not that disabled. I don't want that label put onto me, rather than understanding that disability is a part of an identity, that it's a part of a worldview and an experience. They see it as a detriment. And so one of the things that I really push is figuring out a way to strip those administrative burdens and say, you know, people have a right to a certain standard of living, and we should provide that to anybody.
Yeah, thanks so much. That's your point about how, you know, systems really need to recognize just the inherent value and mattering of everyone is so important, and ties really well into this next question for Jennifer, which is around sovereignty, and how do we build respect for sovereignty into our policies, how for tribes and for Indigenous people, because federal policy is, of course, very complicated by the government to government relationships and the reality of sovereignty.
Yeah, absolutely. So as I mentioned, consultation is a beginning. Representation also matters in policy development, but consent, or being part of the decision-making process, as many of the other panelists mentioned, is what we need for our lands and for our well-being. So sovereignty is a constitutional and a human right. Many tribal nations signed treaties that promised health care from birth to death for the taking of our land. So they signed those treaties to get that, but they were not given that. So our communities are severely under-resourced in medical coverage. This is why COVID-19 had such a devastating effect on our communities. The pandemic disproportionately affected Native populations with infection rates like over 3.5 times higher than non-Hispanic whites. We're also 4 times more likely to be hospitalized and have higher rates of mortality at younger ages due to the virus. So this has highlighted the need for comprehensive and culturally appropriate health services. Sovereignty also means that there shouldn't be an infrastructure project that doesn't include sitting down with tribal leadership and discussing the plan, and also its impact on the land, resources, and our way of life. There should be no plans, policies, or agreements prior to tribal consultation at the minimum. We just need to cut down on bad decisions made on our land and our resources. And through that consultation process, we can provide a pathway to the full realization of our inherent sovereignty.
Yeah, thanks so much for sharing that. And Diana, I think we have time for a question for you. And then I believe we're going to start taking some questions from the audience. So many of the COVID relief measures have shut out undocumented people and mixed status families because of the lines drawn in the original text of the legislation limiting relief to citizens and legal permanent residents. However, many localities did get creative to ensure that all of our neighbors got relief. Can you talk about some of the strategies you saw to ensure that everyone was included?
Yeah, I mean, I think my mind kind of immediately goes to a state like California that used funds to create a program specifically that had less barriers and did outreach to the community to ensure that those undocumented folks specifically who didn't get the stimulus check were able to get cash assistance. I believe it was $500 for individual and $1,000 per family. And they set up a phone line specifically so people could call in and receive that assistance. And it was 75 million in cash assistance. And of course, that has its limitations once you do the math of how many people are actually eligible for it. But I think that's a really great example of some people who thought of, okay, we still have this population that needs this. How do we set up something that is going to be safe given the conditions of the world? Doing it by phone, doing the outreach in the community, and also making it explicit that this is for undocumented immigrants. I think one of the things that often gets in the way when we think of policies and how they don't end up working is making the inclusion explicit. At least when I think of undocumented immigrants in particular, I think often immigrants don't assume that they're included when it comes to some of these programs or services. So even if something wasn't explicitly for them, but we know that we are making it intentional to include them, we need it to be intentional again and making sure that they know that they will be safe when trying to access those resources, that they can trust the people who are providing them, and that it is in fact for them, because oftentimes because they are shut out, they don't assume that they are included, and they don't assume that they will be safe when trying to access those resources. And I think just thinking through I think that was a good example of people thinking through processes, right? Of like, what are those barriers? And these are the things that you would get in that consultation process with communities, right? Thinking through, to obtain these resources, what do people typically need that this community might not have? What was mentioned before, having a federally issued ID, that's something that many undocumented immigrants do not have, right? Or a social security number, or are we allowing ITIN numbers? Or even right now when there's been recent backlogs in providing ITIN numbers, do we need to require those things at all for people to have these services? Right. And again, going back to the trust, are the places where we're providing this accessible and trusted by the community, right? So again, I think that's those are just some of the key kind of questions to ask ourselves, and that states can kind of be thinking through in partnership with communities to provide those services or those resources outside of federal things that may have excluded them, but they can get creative on how to actually do the outreach in the community.
Yeah, thanks so much. So, and thanks everyone for answering all those great questions so far. We also have some great questions from the audience, so we'll start digging into those, and folks should feel free to also keep asking them so that we can dig in more all together here. So one of the first questions is from Jim Pugh. I hope I'm saying that right. Have any of the panelists tried using human-centered design techniques to develop policies that deeply incorporate guidance from people with lived experience? So maybe whoever wants to, I think I saw Mia jump in first there.
Yeah, the reason why I wanted to jump in is because part of the sort of person-centered approach actually came through the disability community and learning how to address specific needs within the disability community. So you look at anything, particularly social work related, they utilize a model that centers the person, and that person is supposed to be included within the decision making of a specific plan or policy. It's not been utilized as well in like a broader policy context as it has been with specific plans. You look at anything from like the IDEA, which provides IEP plans for disabled people in schools. We utilize a person-centered approach, a person-centered plan to try and provide the most amount of supports that are dependent on the specific needs of the individual. We also talk about alternatives to things like guardianship, right? And there's a thing called supported decision making, which is based on a person-centered plan, supported decision making, self-determination, etc. So I think these are all very basic and easily usable modalities to ensure that the individuals, again, closest to the pain, are able to really help shape some of the policies that we're making. And I really want to also really enforce that we look at people who are multiply marginalized, because those are the individuals that are often left out of the conversations, and why so often we have a policy that specifically focuses on one community, but then doesn't look at the impacts of the other communities. So, and I'm sorry for being long-winded, but there's one thing in particular that I'm thinking about, which is when down in Georgia, a couple of cycles back, they utilized the ADA to try to shut down a bunch of voting places that were in Black neighborhoods. And they utilized the ADA to do that because those places were not accessible, which was true. They weren't accessible, but by closing them and supposedly supporting disability rights, they actually marginalized disabled Black and Brown individuals who are living in those communities. So it's really important to think about who you're talking about in terms of who you're included in that person-centered approach.
Yeah, thanks so much for adding that layer of nuance here. It's, yeah, so important. Anyone else want to also jump in and add any thoughts here?
I'm happy to share. I think one of the most crucial things around people-centered and I would say community-oriented design policies is that we have to insist that these input moments are not superfluous, right? It cannot be one and done. As I've said earlier, it cannot be an add-on or optional. And that's actually the thing that I've seen that has destroyed good policy ideas and actually resulted in harmful relationships between communities and people in government. And that's actually the thing that chips away at the integrity behind any type of collaborative effort. And the other thing I want to say is lack of teeth. I mean, we talk about that in policymaking a lot, right? Does it have teeth or not, right? Does it have like the actual enforcement sharpness to ensure that something that you're advocating for in whatever capacity for your community or for the people that you are representing, right, actually changes things, and that you or some party who is influenced by those very policies has the ability to determine and make shifts as needed. And so I think about enforcement when I think about teeth and who has the power to enforce. And it's actually held by very few people intentionally. And oftentimes it's centered around these quantitative measures, right? Quantitative measures that narrowly tick change into something that is a numerical value. And when we're talking about policy, actually policy should be leading to qualitative changes, tangible changes in people's lives that could be measured and then, dare I say, sustained over periods of time. I have served on or helped design policies for years that have been designed or aiming at changing people's lives. When we wanted to add teeth, we ensured that if we're creating a new government body, agency, power, authority, that that person or that body had to report to people in some way. They had to make their findings public. They had to be funded. They couldn't just be an empty office not doing anything. And that someone had to be able to compel them to act if needed. And those people needed to be either directly community partners or representatives or their direct elected officials. And we know that that's not perfect, but it was tangible ways to kind of ensure that teeth were held by people that needed to assess change. Six, our C3, the State Innovation Exchange, has done a lot of valuable work in bringing together movements and impacted communities along with state-based legislators to really create center change. In Nevada, there's been a ton of collaboration leading to monumental shifts on behalf of tribal communities there, including a passage of a law that waives tuition for Native students that want to go to college. And this model is really this shared model for sharing power between governments and communities towards seeing change that communities are themselves advocating for and have determined are the priorities for their own communities. And I've been a part of change in overseeing police departments or other criminal justice agencies, but it's very much the question of who holds power and who has the teeth around enforcement that I think it augments our intention behind centering policy to uphold and make people be able to thrive.
Yeah, thanks. That question of who holds power just, that can't be repeated enough. And also who holds the teeth for accountability. Absolutely. Thanks for that answer. We have another question that came in from Dina Samuels. So it's, do any of the panelists focus on restorative justice and healing within communities, since there's so much healing needed around intergenerational trauma? Feel free to unmute whoever wants to jump in. I'm also happy to do the teacher thing and call on someone, but I'll try not to do that.
I guess I can go. I volunteer as tribute. So I think one of the important parts, as is sort of in the name of our sort of initiative, is the Disability Justice Initiative, which was based off of a foundation of principles led by Black and Brown LGBTQ individuals who were also disabled, who created the Disability Justice Collaborative. And one of their major tenets is restorative justice and ensuring that we provide support and love to our community to ensure our sustainability. And I think that's a very, very important thing to keep in mind as we're thinking about how are the ways that we can support our community so that we don't have to continuously put our minds, our bodies, and our lives on the line just to prove that we're, worthy of equity and justice. So, I think it's been very pivotal part in terms of thinking about ways that we can ensure that our community is supported, and that includes things like ensuring that our staff members get time off, right? Ensuring that we're not overburdening them and stressing them out to the point of burnout. It means that you're paying your workers at a reasonable level, and if you can't get that on your level of sort of supervision, then you support the union, etc. Right? So I think there's a lot of different modules and ways that you can do it and model it within your own organization in order to better facilitate those changes in your policies.
Thanks. Yeah, that's such a good example of what accountability looks like at every level, both internally and external. Anyone else have thoughts they want to add to that? I think we have a little, oh, go ahead, Diana. I saw you went off mute. Go for it.
I don't know if this fully directly answers that question, but I just want to echo what Mia said about, also being in our workplaces, right? We're here because we want to do good work. But at least, certainly specifically from my perch, right? I'm an immigrant, I'm a directly impacted individual working on immigration advocacy. And I think for, even the panelists here, we're all doing this work and we're directly impacted. And I think so much of it, certainly from the immigration standpoint, it can be re-traumatizing for some of the trauma that we've already gone through. And even if you didn't experience it firsthand, you can experience secondhand trauma. And so those workplace policies, I think, are definitely important. And I think another part that kind of goes hand in hand with that restorative justice is that, we also have a racial justice initiative at the National Immigration Law Center. And we are encouraging that work to include management and to really check ourselves on dismantling white supremacy. What are we actively doing to dismantle that within our organization? And and how do we set up accountability for that, right, within internally, because it's obviously what we advocate for externally, but we also have to check ourselves because we do operate within these systems, and they're going to infiltrate what we do internally as well. But I think it starts also internally to make sure that we are doing that for our people, and so I definitely encourage folks to think about what that means for their different organizations, right? At NOC, we also now have a union, and those things are healthy, right? That they're healthy to have that accountability to make sure that that people, again, you know, we are very much for people-centered advocacy, making sure that directly impacted people, they're ones really leading the policy, right? And I think that impacts that applies also to the workplace. And so those are things that I encourage people to kind of think about, is to how do we implement that change at all levels, not just externally, but also checking ourselves at our different organizations working for change.
I can weigh in really quickly. I don't know if this exactly directly answers that question, but NOA only exists to support our tribal leadership and traditional leaders and our Native grassroots partners. We are very much like an ear to the ground, uplifting the voices or the voiced priorities and issues of our communities. But as I mentioned, data on our communities is very scarce, and there's also deep-rooted distrust of handing over our information, since we have a history of that information being used against us by the federal government. So we recently had our second edition of the Indigenous Futures Survey in partnership with Illuminative and the Rice Center out of the University of Michigan to directly combat that by being the largest Native-led survey for us by us. And that data we see can be used by tribes and Native communities or organizations to inform their programming to directly address the needs of our communities, and that supports them in a way that they have identified they need to be supportive. And also it helped to make the case for policy shifts that would benefit our communities. So we're very much about like uplifting our communities and directly responding to their self-identified issues and priorities.
Yeah, thanks so much. Anyone else want to build upon this or echo anything? Otherwise, we have another question we can turn to. So the next question is from Sheetal Shah. Could any of the panelists share examples of equitable forms of policy assessment that they have found to be effective?
Yeah, I guess I'm gonna go. Yeah, so I actually worked with the Ford Foundation before I came to the Center for American Progress, and actually developed a disability inclusion toolkit for nonprofit organizations to utilize to understand how disability impacts a wide variety of issues. And so I often send that out to folks to better understand the intersection of disability and the wide myriad of other issues. And we did that in partnership with interviewing a bunch of different civic organizations. And that happened with, you know, immigrant organizations, racial justice organizations, disability-led organizations to develop it.
Yeah, thanks so much for sharing about that. Also, sounds like an awesome tool that would be very, very beneficial and useful. Anyone else have thoughts they want to jump in on there?
I can add, I'm not sure how often this has been used to assess policies. I think that's the issue with my hesitancy. But I think a thing that we have used to assess programs in my work, in a recent report that we worked with the Joint Center on, was Principles to Support Black Workers in the Workforce Innovation and Opportunity Act. I think that could be an assessment tool that could be impactful is principles for these different programs that advocates and workers develop, and you align those two. So you can assess the programs based on those principles. Are they upholding those principles? Are there tension? Is there tension with those principles? I think it's a good tool to analyze policies. I've seen it more in programmatic work than any federal policies, but I think that would be a great tool to be used more often in that work, is looking at those principles in each of those different policies and seeing whether or not they align. But I can't say I've seen that play out.
Yeah, thanks. That definitely sounds like the principles are really acting kind of at like North Stars almost throughout a process, including the assessment and hopeful recalibration, right, following that. Thanks for sharing. Anyone else want to jump in on this question? Otherwise, I believe we have time for maybe another question and a half potentially. Alrighty, well, I will just, I think we have time for maybe one last question, and then maybe we can, if anyone has any remaining thoughts they want to leave us with, we can save a little time for that as well.
Happy to share, we also have a new Supreme Court Justice.
So exciting, yeah. Just take a moment to let that sink in and bask in that. Yeah, so well, actually, so maybe we should do this. So maybe we can, if anyone has any if any of the panelists have any final thoughts around just anything you really want us to leave with here today, and keep in mind when we're, slightly changing our positions and at our desks later today, or wherever else someone may be doing their work. And maybe we can just start with Jennifer.
Sure.
Sorry to put you on the spot.
No worries. I guess for final thoughts, just there needs to be education for the leadership of agencies about what tribal sovereignty means in the 21st century. So states do not have states do not have jurisdiction over tribal lands. The federal government needs to help protect that. There also needs to be education on Indian law and on the unique struggles and challenges we face as communities because of that direct relationship with the federal government. So, just thinking about like all of the challenges, and the barriers, a lot of that is rooted in us being underfunded in a lot of our services. And sometimes when, because they're underfunded, they have to, like either shut their doors altogether, the organizations or the businesses or operations that are being provided by our communities for our communities, because of that underfunding, they end up having to shut their door altogether, leaving community members without those culturally relevant services and education. Losing access in this way can alter the course of somebody's life, especially our youth, who thrive when they're supported by a sense of belonging. And we know the adverse events in childhood and young adulthood is what leads to entrance in the criminal justice system, poor health outcomes, and other issues that impact the quality of life.
Yeah, thanks for lifting that up. Anyone else have any kind of final thoughts they'd like us to leave with and noodle on?
Yeah, I guess I can add a little. I think that as I've sort of been mentioning before, an understanding of just how integrated the various suppression systems are, and understanding that, none of us are free unless all of us are free. I think that's a very important understanding that we need to really take up to heart and listening to communities and having communities listen to each other, to think of ways in building bridges to develop better structures that really root out all of the systems of oppression, to figure out how do we evolve into a society that can truly harness the power of all communities and allow all communities to sort of be able to gain equity and justice. So I think, you know, you can't talk about racial justice without talking about disability justice. You can't talk about repro justice without talking about immigration justice. So all of these things are combined, and we have to ensure that we lift up each other's work to build that world that we are hoping to get to.
Thanks so much, and thanks for leaving us with in this spot altogether. Just huge appreciation to all of our panelists for just your incredible work, sharing your insights with us here today, and for just really digging into this together. And thank you too to the audience for the really amazing questions that also helped us, you know, move forward in this conversation together here today. So I will turn things over to Jessica, who will lead everyone out.
Thank you so much. And thank you to everyone for this incredible conversation. I was furiously taking notes and just soaking in all of the brilliance today. So thank you everyone for joining us. We really, really appreciate you being a part of this series. I want to repeat one more time, if you have not already signed up like through the Airtable and made sure, and if you're signed on, if it says event participant, that means we don't have your email. So if you would like to get the resource folder with lots of amazing resources, including the Disability Inclusion Toolkit that Mia mentioned, including more information about FPIC that Jennifer was talking about, and lots of other really great resources, please make sure you sign up in that link. And you will also be able to sign up for future parts of the series, including our next one, which will be on April 28th, where we're going to be talking about some of the buckets of money that are out there right now, and what actually where they are, what's actually in them, and what you can do with them. So we're going to get really down to brass tacks about that. So make sure you have signed up there. You should get reminders about the next one, since I know I can't remember things 3 weeks out. I'm probably not alone there. So thank you again, everyone. Thank you to our panelists. Thank you to our co-hosts at 6 Action. And thank you to all of you for being a part of this series, and for all of the work that you do every day in the world. We are so grateful to be in this movement with all of you. Thank you, everyone.